As defined by Wikipedia, decentralization is the process by which the activities of an organization, particularly those regarding planning and decision-making, are distributed or delegated away from a central authoritative location. Hello and welcome to this episode of The Last Mile with Naca. I am Adesuwa Osui. The National Agency for the Control of AIDS, NACA, established its regional offices in the 6 geopolitical zones of the country. What informed the move, and is this achieving the expected results? You'll find out this and more if you keep watching.
Following the findings from the Nigeria AIDS Indicator and Impact Survey conducted in 2018 that assessed the prevalence of key HIV-related health indicators, the National Agency for the Control of AIDS, NACA, saw the need to decentralize its activities and bring the various HIV interventions closer to the grassroots, as well as track and monitor the progress of HIV control programs across the country. This informed the establishment of 6 regional offices, 1 in each geopolitical zone. According to the Director General of NACA, Dr. Gambo Aliyu, this will help close the already identified gaps in the intervention and set Nigeria well on the path to HIV epidemic control before the year 2030. The NACA zonal offices are strategically located in Akwa Ibom for the south-south, Abia for the southeast, Gombe for the northeast, Kano for the northwest, Lagos for southwest, and Nasarawa for North Central.
First of all, NACA's mandate and by extension the zonal office's mandate is to make sure that we capacitate the state agencies for the control of AIDS and make them visible and make them strong enough to be able to coordinate their state responses. So for us, it was to make sure that one, the SACAs know exactly the implications of the prevalence in their states policy-wise and program-wise. This we just had to do by making sure that we get all the SACAs together and begin to kind of reorientate them and make them to understand. Well, in the course of all that, they also shared with us their limitations. And that was, again, what gave us some more evidence to be able to have a very unique response.
We have also supported some of the states in the development of their annual operational plans. We started with the strategic operational plan for each of the states, and we actually also work to make sure that whatever documents that are available in terms of guidelines and protocols that are nationally driven are also made available.
In most of the states, we do a kind of coordination meetings which cut across all the thematic areas. For instance, we do MIE coordination meeting on monthly and quarterly basis to evaluate how far have you gone in the response in terms of treatment, in terms of non-health sector records, so that we'll be able to know where we're here and where there are gaps. We also do coordination meeting with most of the states on areas like care and support, majorly the OFC, which belongs to some of these multi-sectoral aspects of the response. The Ministry of Women Affairs, Ministry of Education on FLHE, to make sure the approach of attaining this epidemic control is diverse and multi-sectoral in nature.
There's a level to which the state response can go. So we had to now, after capacitating the SACAs, got them to capacitate the LACAs. And in what area? It was in generating evidence. Because you need data to be able to do whatever you want to do. So we working with the SACAs now engineered a means, a way whereby non-health sector data and health sector data were, collated together comprehensively. For the non-health sector data, it may look quite scanty because, the non-health sector response still has a lot of challenges. But we are saying, irrespective of how scanty or incomplete, if we were to use technical terms, the data is, it will still help us address certain issues, and it can still translate into programs that will be audience-specific, context-specific.
Advocacy was top on the list for the zonal offices if they were to successfully take the intervention to the grassroots.
First, we had to embark on real intensive advocacy based on all the evidence we've gotten. Every state has its own peculiarities, and the advocacy we embarked on was based on each state's peculiarity. We made sure that we did not generalize things. In terms of their structure, there were some gaps here and there. And by the time we went into the state and began to advocate, well, it drew the attention of the government of the day to how the gaps in those structures can affect their ability to coordinate. So we were now able to really take time and make the NACAs very visible.
The zonal offices also work with community structures like the traditional institutions. We've been able to work with the emirs, and we also work with religious institutions, both Muslim and Christian groups, to be able to pass down information, particularly information that relates to prevention. In doing so, we hope that by the time we move to epidemic control, which will happen before 2030, we should be able to also sustain the achievement.
The advent of the zonal offices also saw the revitalization of the prevention technical working groups in the states.
We were now able to ensure that the prevention technical working groups were functional, working group meetings were functional. I mean, the prevention technical working group serves as an advisory entity to NACA or SACA. So, and a lot of those technical working groups in the states were non-functional. So we had to say to them, it's not a matter of money, it's a matter of intention, wanting to achieve your objective. It's not a one-off thing. It has to be different elements coming together to make sure that we achieve our goal. So every state's prevention technical working group became functional, and they started having their meetings. They're supposed to be having quarterly meetings. Not all were able to do that, but at least they were able to have 2 out of 4 in the year.
The NACA zonal offices facilitates the agency's capacity development and empowerment programs across the country.
Some of the drivers of HIV, one of them is poverty, and the agency has been doing fine by encouraging states to embark on empowerment. For instance, the national itself brought some empowerment through the National Assembly Constituency Project, which we did this last year in Kaduna, Jigawa, even in Kano State. Hopefully, the Kano State itself has taken upon itself during the World AIDS Day. They are able to empower over 150 individuals on various skills so that they will be on their own, fetching some income to sustain their life. More so during the last 201 World AIDS Day, specifically in Suru, Kebbi State, there was an NGO called it Gomo Foundation that specifically did some empowerment onto the vulnerables and HIV vulnerable patients, and some of the empowerment packs were given to them. Specifically for the constituency allowance, there was a startup packs of a sum of 75,000 given to each of the participants at that empowerment program to make sure they sustain the empowerment program and a means of livelihood for them after leaving the activity.
Domestication of the Act by the state governments is key in ending stigma and discrimination in the country.
At that zonal level, we'll be able to make sure those states that have not domesticated anti-discriminatory law were being sensitized to do such, and we are making advocacy to the state assembly and the policy makers to make sure the anti-discriminatory law is domesticated in their state.
Well, in support to most of these states, we'll help them in dissemination meetings, we'll help them in also working with the religious groups. Because in one of the states that I should pretend, the issue of stigma comes up strongly, particularly when two couples want to marry. Through our work with the NACAs and the PLHIVs, we've been able to sensitize most of the states to note that, yes, we have innovative approaches that can allow two couples to be able to marry, even if they are discordant. Discordant couples means one is positive, the other one is negative. And they can conveniently, through PrEP, live as husband and wife, and of course, produce children that are negative.
The zonal offices are working with relevant stakeholders in the states to curb gender-based violence.
In terms of gender-based violence, because NACA at the headquarters has a whole division that has to do with gender-based violence and human rights. And our job is to drive the strategic focus of the interventions that are aimed at, one, promoting the rights of those who are positive. Working with the states and with the support of the HQ, we have also been able to sensitize people who are positive to know that, yes, they have their rights. We also sensitize those who have, in one way, have to deal with those who are positive, that, yes, these people are dealing with, some of them is not because of the fault of theirs that have found themselves to be positive. But most importantly, we work with agencies like Human Rights Commission, offices in the states. We work with police service. Police have PACA, that is, they have an action committee on AIDS, to make sure that even the rights of key population, like female sex workers, are really protected.
The gender and human rights aspect of the agency has come round to make sure they establish what we call gender human rights response team. In such a case, if there is any gender violence case or base case that's established, it is this body or committee that's set up by the gender human rights unit called gender human rights response team in every state that will deal or take care of such gender or such victim or survivor of such a GBV issue.
NACA also carried out several capacity-building workshops for the media to drive its sensitization and enlightenment campaigns at the grassroots.
Media had always worked with NACA, and we've had so many guidelines, so many documents that we just decided to go through all, and a lot were still very relevant. And now, when I talk media, I'm not talking corporate, I'm talking behavior change communication. But we needed the media to be able to get the public to support NACA's policies and programs. And that made us now initiate the strategic media engagement. It was a very robust engagement because we met with all sectors that are involved, key actors that are involved in the HIV response in the zone. That helped us again to capacitate the media. For them to be advocates, they needed to be very conversant, very HIV competent. So we built their skills in HIV and the issues around HIV, and then we got them to be advocates. It's gone beyond just sensitizing about HIV to what are the implications of different aspects of HIV on your livelihood, on your economy, on your life, on everything. We just say we give a human face to HIV.
For Nigeria to attain HIV epidemic control and sustain it, there is need for the states to play more active roles in the national response.
This is an appeal to all the states, particularly states that have very high burden. I happen to have 3 states in my zone that are in the red zone. That it is high time governments of various states take up the responsibility. Time is coming when, if we don't do, these people who are already on treatment may not be able to be sustained on the treatment they are in. So all stakeholders must put their hands on deck. We're also looking towards sustaining the epidemic control, which we hope to reach very soon. And if nothing is done in that regard, there will be a boomerang of the infection, even after we have reached epidemic control. So now is the time for us to come up and take the responsibility of funding the national resources for the national response, both government and organized private sector.
The NACA zonal offices will consolidate the agency's restructuring posture and build on the success the country has recorded during the Nigeria AIDS Indicator and Impact Survey.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
The update segment brings you highlights of NACA's activities across the country and elsewhere. Don't go away.
Officials of the National Agency for the Control of AIDS, NACA, carried out HIV sensitization, testing and counseling outreach program in Abuja. The Deputy Director, Social Behavior Change Communication of the agency, Dr. Daniel Ndukwe, shed more light on the purpose of the event.
The event that we carried out today is to create awareness about prevention of HIV and indeed other sexually transmitted diseases, especially this period of Valentine, when a lot of people are likely to be involved in what you can describe as unsafe sex or reckless sex. And that is having sexual intercourse with somebody who is not a regular faithful partner or having sexual intercourse without the use of condom. So the message we brought to the people is to say abstinence is still there. If you you choose to, you can abstain, otherwise be faithful to a partner that is faithful to you. Then the third option is to use condom consistently and correctly to avoid the transmission of HIV. Showing love is not spreading HIV, it's not spreading hepatitis, it is not spreading other sexually transmitted diseases. So that's the message we bring to the people. We also offer them HIV tests and counseling, and then for those who have need of them, we give them condoms.
The Valentine's Day celebration has come and gone, but the message from NACA remains, and it is saying, do not engage in risky activities that predisposes you to HIV infection. Support the agency to fight AIDS to finish.
UNICEF presents that globally, at least 300,000 children were newly infected with HIV in 2020. Now, of this alarming figure, Nigeria was responsible for 20,695 cases. This indicates a need for a much more strategic approach to prevent further decline in the nation's HIV infection rate.
About 300,000 children born HIV positive. Over 20,000 of them were born in Nigeria. This is a crisis of immense proportions, and it can potentially erode all the good work we've done over the last 2 decades.
The taps in the general population and key affected population are now running slowly. However, that of mother-to-child transmission is the one that is still running fast. And this means this year, 2022, we're going to look at expanding our services to include every pregnant woman and get them tested and make sure that every HIV-positive pregnancy is prevented from transmitting that disease to the newborn.
The HIV Trust Fund is timely and will be critical in helping us address the gaps in acquiring test kits, laboratory reagents, and drugs for pregnant women over the next 5 years. We are excited about the private sector commitment to this cause and wish to thank them in advance for their engagement.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has 2 components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a #1 enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesu Alsi. Goodbye.